Good morning, everybody. It's Positive Tuesday today, January 9th, 2024. Our very good friend Mike Schafer is joining us this morning in Fitzy's absence. No idea where he is. But first, for DrydenWire.com, I'm Ben Dryden. You're watching Positive Tuesday with Ben and Fitzy, presented by Professional Exteriors and Interiors. With 20 years of experience as locally owned and operated business, provides quality work both on the inside and on the outside of your home or business. Like Fitzy and I, they believe that it's the little things that make a big difference. Give them a call today. See what they can do for you. The number's right there on the screen. 715-520-2271. As I mentioned, Fitzy's off today, probably playing Sheriff. So joining us is our very good friend of the show, Spooner Health CEO Mike Schafer. Mike, good morning, sir.
Morning, Ben. Thanks for having me again.
Thanks for coming on at last minute notice. Fitzy, as always, I can't be on next week. It's
Well, and I've noticed Fitzy must not like me anymore because I'm only on when he's not anymore. So it must be a plan of his.
Well, I'm not going to say anything about him. No, we love it when you come on. And again, thank you. You've been on. You've been how many times? I don't know how many times you've been on now.
I don't know. I mean, it was quite a few times ago when I asked for my 5-time jacket like they get on Saturday Night Live.
Right.
More than 10 now. So yeah.
Good morning, Dirk, and I can't wait for your weather forecast at the end of the show today. Because hey, speaking of, I was thinking about Dirk this morning. So last night, I've made it like through the first half of the college football playoff game, because then it's bedtime. Yes. So I get this morning and I'm watching it on Sports Center, and it's great because then when they go through all the highlights, then it's okay. Now we have all of our experts coming on and telling us why Michigan won. Mm-hmm. And I was thinking, that's a really good job to have. Like, you're not predicting anything. It's just now that it's over, here's everything that happened. And I thought of Dirk. I'm like, that's kind of like the weather, the news, watching local news at 6 o'clock. And like, first half of it is, here's what happened today. I already know this.
Exactly. Well, I figured out why you're so interested in Dirk's forecast every week.
Why?
I watched your interview with Emily Gall last week. You took a meteorology class in college. So that put 2 and 2 together for me.
Yeah. I love it. Well, and honestly, Dirk is the only one that I actually trust. Because everybody else is wrong all the time. All right, so we have some things to get to. Obviously, with you in your capacity as Spooner Health, we're not going to be going over some crime and court stories. But I do want to talk to you about the cold and flu season, COVID, and just get your thoughts. I don't know if you noticed yesterday or saw yesterday about the GOP medical marijuana bill that was released. I'm curious on how that impacts in any way, shape, or form Spooner Health or other local health organizations. But first, as always, we do start with sports. So I have a question for you. Now that the NFL season is over, we'll stick with the NFC North because I know you're a Vikings fan. I'm a Bears fan. But in the NFC North,
it's over for us.
It is. What was most surprising to you now that the season's over? The Lions winning the division, the Packers making the playoffs, the Vikings 7-10, or the Bears also 7-10. But yeah, so which of these is the most surprising?
I'd say all of the above, with the exception of the Lions. I expected the Lions, what they showed last year, to be good, and I'll briefly talk about all three. Vikings started off very poorly, losing close games. Did not expect that, especially after their season last year. Got on a roll. Then Cousins gets hurt. I thought the Vikings would be in the playoffs again. Bears, I wouldn't expect them, especially the way the season started, to end up in a position where you should be a little embarrassed by your Bears losing out to the Packers last game of the year when they had a chance to knock the Packers out of the playoffs and knock the Vikings down in the standings to the fourth seed, and they're fourth in the division, which would have given them both a higher draft pick and an easier schedule next year. So thanks to your Bears for nothing. But I do think probably the Packers. I mean, the way their season started, young team. You've read youngest to make the NFL playoffs, and the way their fan base has been screaming for the firing of their defensive coordinator all year. And now with the youngest team in NFL history, they're in the playoffs. And
I didn't know that. I didn't know it was the youngest team in NFL playoff history.
The youngest to ever make playoffs is what I read with the average age.
I didn't know that. I like all of it. I like all of that. By the way, good morning, Renee, and good morning, Stacy. Yeah, so if the question is, what are you most surprised by? The Lions winning the division, the Packers making playoffs, and the Vikings and Bears being 7-10. I agree with you about the Lions because all the Las Vegas and the sports odds all expected. I mean, isn't that the whole point of what would be considered a surprise is if it didn't meet the expectation?
Exactly.
The expectation was for the Lions to win the division. They did. So not surprised by that. The Bears finishing last, I'm not surprised by that. The fact they got 7 wins is a little higher than I thought they would get, actually, but I would have probably thought like 5. But it's not that surprising. The Vikings being 7-10, yeah, they've had 3 starting quarterbacks this year, 4, something. I mean, you can't. Come on, you're not going to be able to make the. Typically, you're not going to make the playoffs when you have so many injuries at that position. So it doesn't surprise me. So yeah, I agree with you. You're right. It is the Packers, but interestingly, I don't think it's even the Packers that surprises me the most. I looked it up this morning right for the show. They were 9-8 this year, which isn't spectacular. But last year they were 8-9, and they had Aaron Rodgers for a full season.
Exactly.
So that was interesting. And then I looked at their QBR. QBR, of course, is the quarterback rating. It is like the single one thing that is probably the best way to compare quarterbacks and how they're doing. Last year, in their 8-9 season, Aaron Rodgers was 26th in the leagues of all quarterbacks, which there's only 30-some that qualify for this, 26th. Jordan Love came in, and, first year, he wasn't really spectacular in all these small roles he played for the last 3 years. He's actually 9th in the NFL. So actually, I would say the biggest surprise is Jordan Love's play. I'm really surprised.
And question for you, is it time to size him up for his Hall of Fame jacket yet or not?
No, not yet. But they may be onto something. Right? It was Brett Favre. Then they drafted Aaron Rodgers and let him sit for 3 years, and Brett Favre was ticked.
Yep.
Then Aaron Rodgers, they signed Jordan Love, and Aaron Rodgers was ticked, and he sat for, I think it was 3 years, wasn't it? At least 2 or 3 years. I think the Packers may be onto something, that when you get your quarterback, you don't necessarily have to start that person right away. If we feel as though that it's better for them in their development to sit for 2 or 3 years before you throw them in. I don't know, but just saying.
When you have a Hall of Fame quarterback to sit behind, that's
also nice. That's helpful.
But I mean, look at the Bears with Fields. Fields came in with a lot of hype and hope. Hi, Mary. And the hope, and they threw him to the wolves on a team that isn't great.
No.
But then again, you look at C.J. Stroud down in Houston, who had a great year as a rookie this year. So it's working for the Packers. It is. There's no doubt about that. So.
All right. Do you have a sports question this morning?
Of course I do.
Of course you do.
For the Bears fan, what do they do with the number 1 pick? Do they go for a quarterback and dump Fields? Do they keep Fields? I mean, at one point this season, it looked like they could have 1 and 2 because they have a number 1 pick because they got Carolina's pick. And at one point they were looking at that. Yeah. They obviously aren't. But what do you do as general manager of the Bears, Ben?
Well, obviously last year that was brilliant, right? They traded the first overall pick. They got 2 future first-round picks, which you just talked about. One of them is going to be next year. And they also got a starting number 1 wide receiver who had a career year. He was great. So obviously you don't know if you're going to get a trade. So the number 1, like 1A, is you get Caleb Williams out of USC. Maybe even sit him and don't trade Justin Fields. Just let him sit for a year because the team isn't that good still. So maybe let him sit for a year. It's on his 4th year, I think it's the 4th year for Justin Fields. So he's cheap, right? And you have a 5th-year option. Just let him sit for a year. That's like 1A. Duh. But 1B is if you get a good enough haul, if you get a couple 3 first-round picks and a player that's an impact player right now, you got to take it. So what I think they should do is plan on Caleb Williams out of USC, but don't be locked in. Right? If you get a good enough deal, you take that deal because they have so many holes. The Bears are horrific. That's what I would do. What do you think? What do you think they should do?
I think they need to make a decision on Fields. Are you the number 1 or not? If they think Fields is their number 1, I would trade out for draft capital. Would probably be the direction I would go. I wouldn't waste it on good point, Mark. Bart Starr. 3 Hall of Fame quarterbacks in a row. Packer fan base has been spoiled. But anyway, I think you think about that. But if Fields is not your quarterback of the future, I think you take a quarterback there. And
I hope they do.
Is the guy from USC the number 1? They say he is. Drafting quarterbacks number 1 is such a crapshoot.
It is. It's a coin flip. You just don't really know. The musical chairs with quarterbacks for my Vikings was mind-blowing. Then JJ goes out for 7 weeks, lost the battle. I agree tomorrow.
Well, and look at they won, 4 in a row with JJ
I
out.
know.
And
Right?
then Cousins starting, and then 2 other quarterbacks. Dobbs looked like the second coming of I don't know who,
Right.
and he just filtered out. Yeah.
Yeah. All right.
Tough to be a Viking fan, but I say that a lot of years. So
Hey, I've been a Bears and Cubs fan, my whole life, and how's that working out for me?
exactly.
Well, Cubs finally won. Anyway, at the very end of the show, I do want to get your prediction. We'll just do the Bears, or not Packers and Cowboys. I'll get your prediction on that. All right, so I want to get to like cold and flu season from a Spooner House standpoint, COVID, and your thoughts on GOP medical marijuana bill that was released by, the Republicans yesterday. We'll get to all that in 15 seconds after a word from, wait for it, Spooner Health.
Health, compassion is at the center of everything we do. It's rooted in who we are and why we're here. It unites us as providers, neighbors, and as a community. Learn more at spoonerhealth.com.
Oh, that was a brand new one, and I feel like we missed like the first 2 seconds. So it was brand new. Good job, Michelle Martin. I still like the one. I still like your old one.
In our patient satisfaction surveys and in conversations with patients, they appreciate the fact that staff got to know them. Staff really took their preferences into account, and they just feel grateful that they are being cared for as a person.
To learn more about our services, visit spoonerhealth.com.
I still like that one because you're in it.
I suppose we could charge double this week.
Yeah, I'm sending 2 invoices this week. Yeah.
When Michelle sent that other one out to be viewed, I said I love it because I'm not in it. It's not real comfortable sitting here on camera watching that. With me in it. So I like this new ad a lot better. And,
no, it's very nicely done, but I think I missed the first couple seconds, so maybe I didn't do that correctly. I'll get those details worked out. So it's January 9th now, Spooner Health. I see a lot of early of the year, maybe like 2 months ago, maybe not so much now. I saw a lot of stories about a real big uptick in cold and flu season and maybe even COVID. But let's start with cold and flu, unless this somehow ties into COVID. What are you seeing this year at Spooner Health?
Well, we're seeing normal patterns. I just when you said that, I pulled up the surveillance report we get from the state lab just to see what's happening statewide. And, influenza A has been pretty dominant, and it typically peaks out in December to early January. And it looks like we're seeing kind of the same thing now. The strongest week of influenza A was about the week of the 16th of December. So
I'm sorry, you said influenza A?
Influenza A. That is the really bad flu. I mean, it's
okay.
Virus flu.
So the letter after the influenza is the how bad it is.
And remember, I'm an administrator. I'm not a medical person. So
I know that's true. Let's be very clear.
Yeah, but I mean, this year the worry, just like last year, was influenza, COVID, and RSV, was respiratory disease, all hitting around the same time, and they did. But not at levels that overwhelmed hospitals, health systems, anything like that. I would call it a fairly normal flu season from what we've seen in this region so far.
Okay. Are people that coming in, well, let's go to the COVID part.
Yeah.
Is this, it sounds like I'm saying it sarcastically or something, or just, but I want to ask, like, is this still a thing? I know it's still a thing, but you know what I mean when I say, is this still a thing?
Yeah. COVID is still a real thing. It's not, the current strains are not hitting as hard as a couple of years ago.
Okay.
We're not seeing as many hospitalizations, but it still hits some people really hard. And people are still, you're hearing of long COVID, people who have symptoms months and months after having COVID. That's still a real thing. So when people say, COVID's really not there, it's no big deal. For a lot of people who get COVID, it is no big deal. It's a bad cold. What I'm hearing with this strain, though, is friends of mine and people I know who've been sick have been a lot sicker. It's like having the flu down hard for days. I had one friend tell me that was the sickest he's ever been with the flu, but recovery comes fairly quickly. What we're not seeing is the high number of hospitalizations with, early on, the first 2 years, the first 2 COVID peaks, I would call them, you saw a lot of the respiratory, the lung issues, the breathing. We're not seeing that. but it's still out there. And there are some people, especially those that have other underlying health conditions, that have a really, they have a tough time with it. So
Why?
just to give you an idea. Oh, go ahead.
I was just saying, why? I mean, is there a particular reason? Is it? I think you had mentioned that maybe this isn't as bad as the previous versions. Is it just that, or what would you attribute this to? That when we do have them, they're just not as bad. Is it simply that this one is not as bad as the last COVID strain or the thing that came out?
Yeah. Again, you're getting me out of my lane, Ben. But from what I read and hear, some of it is how the disease mutates. You get the different variants that come, and these variants aren't as hard. Another thing is, theory is that people have got more immunity to COVID than they had in the past. See, someone mentioned immunization,
sure.
Getting the COVID vaccine. Recommendations are still for vaccines, especially for those over age 65 and those who have health conditions. I would think individual immunity does play a part in that as well. It's kind of all over the board, but
Sure.
back in, I'm just looking at numbers. Back in 2022, on January, on January 12th, 2022, there were 2,400 people hospitalized in Wisconsin with COVID as a diagnosis. I mean, they might have been hospitalized for something else, but also had COVID.
Okay.
Including almost 500 of those in ICUs.
500
Last year,
ICU.
that number peaked at 644.
So 2023, last year, same
Yeah.
time, January 12th. What was the numbers?
It was 644.
For COVID.
And of those, about 120 were in ICU.
120 in ICU. So we went in 1 year, from 2,400 down to 644 in the ICU from 500, which I would assume like this is the bigger number. Well, I shouldn't assume that, but ICU, of course, that means a little more serious, but 500 down to 120. Wow. Do you have any updated, even if it was like from 6 months ago or even this year already?
As of this week of the December 11th is the last I have, there were 428 people hospitalized.
In ICU?
At 23.
Oh, my goodness. So in 2 years, went from 500 down to 23 for ICU.
No, in 2 years, yes.
Yeah.
So, I mean,
okay, so it's still there.
Yeah. Pardon me?
All right.
So what we experience is we're not seeing hospitals overwhelmed. I mean, we were overwhelmed back in 2021 when they had a peak there, and in 2022. But we still see times where we have a hard time getting patients to an ICU bed at a larger facility for other reasons too. I mean, there's still a lot going on in hospitals throughout the region. So,
what is the biggest? Is that amongst, if you had to put your top three, and I know I'm putting you on the spot here, so we're not going to hold you to this, the exact top three, but of the top 10, give three of the top 10 issues that hospitals are facing right now, not specifically Spooner Health, but just in general. Is that a thing, what you had just talked about trying to get those beds?
I would start with staffing, because staffing plays a huge role in that. And back during COVID, you'd hear all the time, we couldn't get patients because there were no beds available. Well, and sometimes there were beds available. There's just a crisis, a workforce crisis in Wisconsin hospitals and healthcare, just like almost every other industry.
It seems like it right now, yeah.
Yeah. I mean, when you go to talk to our local legislators, Dave Armstrong or Romaine Quinn, and you talk to them about workforce crisis, they will tell you, yeah, we hear that from every sector we meet with. So that plays a huge role in the ability, if a Duluth hospital, doesn't have enough staff, and right now I think they're in a good position, but a few months ago they weren't, to open beds up, a nurse can only care for so many patients at a time.
Yeah.
Staff can only care for so many. So workforce, and the sad thing in healthcare, it's going to get worse. Youngsters are not going into healthcare like they did in the past, younger people. And the healthcare workforce is an older workforce. So you're going to see what the Hospital Association used to refer to as a silver tsunami, people with hair like this, retiring. And we aren't backfilling those positions enough through schools, through everything else, because the interest isn't there.
Law enforcement, you're right. We used to talk about it was just like one area. Now it's, and I believe at the very beginning it was kind of like teachers. That's usually what the conversation was. And then it was all of a sudden law enforcement. which is still a thing. And then it was lawyers, which I've never in my life I thought we would have a shortage of lawyers, but it's not necessarily the lawyers, but people wanting to go to be an ADA, a district attorney, a judge. I mean, we just have a judge down in Barron County right now. He's the only person even running. What the frick? One person. I mean, good for Sam Lawton. He'll do great, but that's just so bizarre. And then it was nurses during COVID, and we've heard about this retirement of a lot of the old. And the biggest question is for all of these. So how do we fix it? How do you get somebody to want to go into it? Is it simply throwing money at the problem? We're going to pay you way more than we did for doing the same job 5 years ago. Is that how we fix it?
You look at, when you look at Gen Z and you look at, we just went through a few months ago with our managers training on generational diversity because, the workforce is changing. Money isn't the prime motivator for a lot of these younger people. It's quality work-life balance. So throwing more money at that problem doesn't really help. Then you look at healthcare. Nursing is an example. It shocks me when people go to nursing school and then they think they're going to get a Monday through Friday 9-to-5 job.
I would have thought that because I actually did. Well, that's dumb now I think about it. I probably would have thought that for the first 2 seconds.
Yeah. But hospitals are open 24/7. A lot of those jobs in hospitals, when you're young, you get the not so great shifts. I mean, that's just the way seniority in that works. So,
and it's not just in healthcare. That's pretty much universal in any job.
Yeah, my oldest son's a pilot. Just got hired as a first officer for Delta last summer. He's on every weekend. It's just the way it goes.
Steve says staffing agencies are playing a big role in it. Do you agree with that, Mike? And if so, could you please explain what that means?
Okay, I would agree with it. I would say it's less so than it was. But during COVID, staffing agencies, new ones popped up all over that they would bring nurses on board as contract people. Then they would negotiate with hospitals. So hospitals were paying, 3 times the rate of what they would pay staff. Nurses were making a lot more than they would make working, say, for Spooner Health. And coming in on contract for 13 weeks at a time. So contract
just
staff
to fill the short.
Well, and they created, I think that's where Steve might have been coming to. They partially created more of the problem because they saw the opportunity for them to make money as a staffing agency off of the crisis going on in healthcare. It gave the opportunity for some of these nurses to work for a lot more money. So we saw staff that, went to work for agencies and ended up at neighboring hospitals where they could drive to work. We were using, and we still use staffing agency for some of our night positions, people who are driving from Eau Claire or Duluth. It's what we were proud. We had never used a contract staffing agency for registered nurses in my time here. And a lot of hospitals have to. And that was, I think, because of our culture and everything else. But boy, for us to have to use staffing agencies and pay, I think, 3 times almost of what we're paying our own staff. They were getting benefits on top of it, and the staffing agencies, they don't get any benefits with it. But yeah, they really contributed to that. They pull your nurses and send them elsewhere.
Is that a situation, if I'm hearing that right, that you lost some, is it maybe not specifically Spooner Health, but some of these do, where they have these agencies coming in, and please tell me I'm wrong or correct me, but they come in, they get more money, and then the staff that's currently there, that is already, the ones that are there, go, I'm sorry, you're getting paid how much? I'm going to go work for that agency, therefore that creates a hole. Is that what I'm understanding?
That's the problem it creates.
Okay.
And we didn't lose too many. We lost a couple to staffing, or a few to staffing.
But I don't blame them, at all.
Yeah. Well, they took advantage of the situation, and they got a chance. They got a chance to make money that they normally couldn't make.
I know. So I don't blame them for doing it because it's best for you and your family and the money. I would only caution something I was told many, many years ago, and I've never forgotten. Chase good management, don't chase money. That's what I was told, and I don't want to get into all the reasons. You can probably figure out all the reasons why that is probably a smart thing to do. But sometimes, if you had double the pay, and I'm not saying it was double the pay, but if you got to double the pay to go somewhere else, that's got to be pretty tempting. That's going to be pretty tempting.
Like I said, I didn't blame anyone who did it. You have to look up for yourself, especially if you had a spouse who carried the health insurance and things like that. I mean, some people left for the money without having health insurance and things like that, and that's dangerous. But if
Yeah.
you had the health insurance, you really didn't need the benefits that you get from working full-time or part-time
Yeah.
at a hospital working for them.
That makes sense.
Yeah.
But the other ones, good morning, Representative Gay Man of Fitzy.
Oh, good morning, Representative.
Hey, speaking of, well, a Republican, I guess, really here, I want to ask you about, and we can get back to what we're talking about here, but I want to ask, as long as I saw her on, she was on yesterday, the Republicans announced a medical marijuana bill, a medicinal, whatever. That was announced yesterday. It doesn't, I'm a little confused by it. I don't know if you had a chance to read it. I've read some of it, and it sounds like this isn't like you can just go to the hospital and doctor says you need it, and okay, I get it here at my local Economart or something. But I don't know if that to be true. Sounds like there's like 5 different areas you can get this from. So I'm just a little confused as to how that works. Have you had a chance to read it yet? And if you have, or do you know enough to be dangerous? Like I feel like I understand it enough because I want to know the scenario of my grandma's passed, but someone's grandma, 80-year-old lady, she goes to Spooner Health and, or locally, I should say, and they say, okay, yes, medicinal marijuana would be good for you, but they can't prescribe it. They can't get it. They have to go somewhere else. How does this, if it came to fruition, how does this impact Spooner Health and other local healthcare providers?
I haven't had a chance to really dive into it, but I've seen what's happened in some other states with medical marijuana. To me, the devil's in the details. From what I saw from the Assembly bill, I believe that it sets up for state-run dispensaries.
Yeah, which I think is like the first ever.
Yeah, well, I think Minnesota had something kind of comparative,
Okay.
But I once sat through a presentation I heard on Minnesota where it really took things out of the doctor's hand once a person qualified for medical marijuana, however they qualified, and put it in the dispensary's hands and the pharmacist or whoever at the dispensary. And at that point, there was real concerns about, the doctor not being involved, who knows every other medication that patient is on,
right,
along with the marijuana. Now, my understanding, and I could be wrong, is the Senate is in Wisconsin is more for public dispensing of medical marijuana. And I don't know if that's true. I've heard that. If that is, as I said, the devil's in the detail. How will the Assembly bill compare to the Senate bill? And we know that they don't always, even though they're both Republican held, they don't always work together that well. So, I mean, most states, I don't know how many, but it's become much more common for medical marijuana. Studies show there are things that it works for. From the administrative sides of things, like even working with the hospital association, they're the type of things they usually don't take positions on because it's more of the medical thing, more in the physician's realm than administration. But I think it's just going to be interesting to see. I would assume when Robin Vos put that out there from the Assembly that he's got enough votes to pass at the Assembly. It'll be interesting to see what the Senate does with it at that point. And I think that the way it's dispensed is probably going to be an issue between the two.
Well, and especially if that was my question I still haven't gotten an answer to quite yet, is there's going to be these 5 locations. I don't know if they've been determined yet, but obviously it'll be like Milwaukee, Madison, Green Bay, Eau Claire, Superior type of a scenario, something like that. Yeah. But that same 80-year-old lady who needed this and is said that, yes, you can have this. How are they going to get to some of these locations? That's a little concerning. I'm not, again, it's not if I'm for it or against it, but looking at it just from a political standpoint, Republicans had to do this at some point anyway, because now it could be potentially, losing votes, because that's just how this stuff works.
Yep.
It is, I think Robin Vos even went on WIS Politics and said it's going to be like the most strict law for medicinal marijuana in the entire country. So they're going into this not necessarily wanting to, but knowing we have to. But if we're going to do it, let's be smart. And in a weird way, I'm okay with taking it at slow amounts of time. I just hope it actually does what it's supposed to be doing. Yeah. That people that do need this stuff can actually get this stuff. As long as it does that, I don't know who could really be against that too much. The only reason I suppose would be like the slippery slope aspect. But we know that's coming.
Yep.
So if we just look at this individually, it feels like it should be done. But I don't know. I don't know where we're going to go with that. So I can't wait to actually read more about it. Yesterday was a busy day, so I read just like 10 minutes of it this morning. I still don't understand it fully. to make
I'm
an
with you.
actual comprehensive opinion on it. Are you planning on having conversations with your legislators from a Spooner Health CEO standpoint, or again, is this really has nothing to do with us?
Well, it does more from the clinic standpoint, and the
Sure.
prescribing of it, but from the hospital standpoint,
No.
it's not something that would be used in hospitals. It's an outpatient type thing. So, like I said, it's one of those things that we have bigger fish to fry with our legislators, I guess, stuff that we're dealing with right now that really affect how we operate the hospital. And that's what I get involved with more than the medical side of things like that.
Yeah.
You have the state medical society, places like that kind of represent the physicians and the patients on those types of things.
Which entities do you pay attention to most, or is it a case-by-case basis? Put them in order, like from a Spooner Health CEO standpoint, what the county board is doing, what maybe even it was even start, I guess, with, is Spooner Health in the city of Spooner?
Yes, we are.
All right, so city council, county board, assembly, senate, governor, Supreme Court, presidents, etc. Do you look at this, not from your own personal opinion, but you pay attention to certain things or certain areas more than you pay attention to others? Like city council, never. I mean, rarely do they ever make a decision that affects us. Which entity of these kind of you pay attention to the most?
The state legislature, most definitely, and the federal government more at the CMS level, which is Center for Medicare Services. They're the ones that basically write hospital code, for what our rules and regulations we have to live by. And they have a lot of power. Of course, we try to deal with our federal legislators to get certain bills passed, but they have a lot of power that sometimes we have to go to the legislators about. So it's really keeping on top of those two that I do the most with it. As far as
Dave, I don't know what you're talking about. I don't remember which one. Sorry.
As far as the county and city go, I watch what they do pretty closely, but there's not too much that ever comes up that really affects how we're going to operate or affects us. And I've been asked to come to the county board during COVID just to talk about what we're seeing in COVID. But quite honestly, our relationship with our local governments is very good with both the county and the city. And there's not much they're doing that has long-term effect on us. So we monitor it, but there's not a lot of lobbying or conversations that have to happen there because they're both very supportive of Spooner Health, of healthcare in general.
You've been Spooner Health CEO for, I'm going to guess 35 years.
Only 33.
33. 33 years. What is outside of technology? Give me two more things that has changed the most in your profession since you started.
Workforce. And when I say workforce, again, a lot of generational type things we have to deal with. Priorities of the younger workforce are different than the older workforce. The days of the baby boomers just coming to work, put in your 8, your 10, whatever. Those are gone. And I'm not saying that's a bad thing. And I'm not judging the younger generation. It's just that has been a huge change. And I'll be honest, for me, when we first started hearing about millennials, and having to change how we do things because of millennials, I'm a tail end baby boomer. I come from the fact, what do you mean we have to change the workforce?
Right. Like you work for me, so what now?
We really have to change what we look at. And I think we've done it very effectively, You've seen what we've done for our employee engagement. You're going to get a press release here in the next few days on employee engagement again. Nice. Very positive from last year. So I think that would be, technology is definitely number one. There's no doubt.
I see. So what's 2 and 3? And it sounds like number 2 is workforce, and not just. I understand what you're saying. So if we put in, not going to hold you to the order of this stuff, but okay, workforce. What's the third one?
I would say the way we're paid, reimbursement, insurance companies, the influence insurance companies have on healthcare.
Good or bad?
Bad.
Why?
How do insurance companies make money?
Well, I don't know. I mean, depending on what insurance they're covering.
They prime up, charge your premiums, and the less they pay, the more they make.
Oh, sure, right.
If you've ever had to have a surgery or an MRI, prior authorization process. What we go through as a hospital to get an approval, I just had a knee MRI, to give you an example. We had to have someone at the hospital had to call, send in parts of the medical record, get approved. We do pain injections here. We have a specialist out of Ascension Duluth who comes down. Hours are spent, up to hours, prior authorizing every one of those. The amount, there was a study, I wish I could remember who did this study, but of your healthcare premium dollars, only 43% or 43% of your healthcare premium dollars go to things other than paying for healthcare, paying providers. It's insurance companies, it's pharmacy benefit managers, it's the middleman, it's all these things. So as we start hearing about how expensive healthcare is, and it is expensive. I mean, hospitals are expensive. I will never say they aren't. But there are so many other people involved in the healthcare system that bleed off money from your healthcare premiums that yesterday, I think it was the Wisconsin Health News, something we get a daily news piece from there. They showed the profits of every insurance company licensed to health insurance company to do business in Wisconsin. Some United Healthcare making 12%. Most of these are making 4 or 5, 7, 8%. Hospitals aren't making that kind of money. Health systems aren't making that kind of margins. So
see, and I think that would surprise people simply because we look at the building, right? Yeah. We look at these. Some of these are some of the biggest or best, especially in rural areas, some of the nicest buildings in the entire city or county. So I would think that most people would be surprised by what you just said, that we're actually not making what you think.
I mean, a typical Goodyear in a health system is a tax-exempt entity where tax exempt. If you're doing, you need 3% to reinvest in your equipment now. Just to reinvest in, I mean, an MRI, a couple $1 million to buy an MRI. We use a mobile here. We don't have the volumes for that. A CT scanner, $750,000. You can't run an emergency room now without a CT scanner where, 25 years ago, we didn't have a CT scanner in-house. So, yeah, it's really, I mean, it's the technology, it's the workforce, and it's how we're paid.
And how we're paid. Now, how do we fix that? Is there a fix to the paid? We talked about the workforce part and where that is, but in terms of, so this is where it is now, and you're saying this isn't good. It's worse than it was, The question was, what's changed in the 33 years been Spooner CEO? And you're saying this is a negative thing, a bad thing. Yeah. Is there a fix to this?
I'm usually an optimist, but I'm not sure. It's interesting to see the different forces at work lobbying on this stuff. And I'll give you an example that's probably getting way too far in the weeds, but under the Trump administration, the federal government, CMS, Center for Medicare Services, put in some very heavy price transparency guidelines, rules and regulations we need to follow, which include being able to shop prices, having things on your website, all these different things. And they put them in place for hospitals, for insurance companies, and for businesses that self-insure their insurance. Hospitals are under scrutiny on prices all the time. And it's very difficult to price out hospital services because when we bill Medicare, if I get too deep in the woods, just stop me, Ben. But when we bill Medicare, so you come here for a colonoscopy. We have to bill for the colonoscopy. We have to bill for the anesthesia separate. We have to bill for medications used separate, rather than bundling and say your colonoscopy is going to cost this many dollars, but if you have to have removal of a polyp, it's going to cost that much more. So it's done on time and different things. So it's very difficult. We can give estimates on services, but to give an exact price is very difficult, unlike going into a store and buying something or ordering something.
I see. So what they're kind of looking for is a menu and a cost to each one, and then you just select them all, so then you can, add it up and figure it out yourself. And you're saying it can't work that way?
Well, it does, but you really got to know what you're shopping for. I mean, to be very honest.
Well, that's true. That's true. Like, we all know what a cheeseburger is, and we all.
I mean, I'm going for a colonoscopy. Well, you're also going to have some other charges besides that. So,
yeah, which ironically, I just did go to Spooner Health for a colonoscopy.
Always call the local hospital to get an estimate.
Yeah, I did. I just whatever you think is best.
Yeah, but to take that a step further, so if we don't comply, and Wisconsin has been a leader in price transparency through the Hospital Association. We've had Wisconsin
Okay.
Price Point out there that you can go compare hospitals and get estimates compared to hospitals, so you could see in the most used procedures what it might cost at Spooner, Shell Lake, Hayward, Rice Lake,
Okay.
to get a general idea. And if we don't comply with the federal regulations, we can be cited by the federal government and fined. That's there. Well, all of a sudden in the Wisconsin State Senate, there is a transparency bill that has come out. They want a state transparency bill too. They say it will mirror the federal legislation, which is interesting because the federal legislation just changed. They just announced their new changes as of the first of the year. So they always change rules. So the state of Wisconsin is talking at the Senate level and hasn't even got out of committee yet, but they're talking about, okay, we want new legislation and new rules at the state level that may or may not be different than the federal level. And then if hospitals don't comply, we can fine them. And what's interesting at the state level is their minimum fines are start at where the maximum fines for the federal level are. So it's giving us a separate set of regulations, which 15 years ago or so, this state got rid of the second set of regulations that we had on hospitals and said CMS should be the rules that hospitals are to go by. So this has been proposed in the Senate that we have a whole other set of legislation, which means we have more administrative costs to comply. We're spending more money on people to work here that aren't caring for patients.
It doesn't sound like a GOP thing.
Yeah, no, it doesn't.
Right?
And what's
in the
ironic,
Senate and the Assembly,
it was introduced by a GOP legislator or senator. But what's really ironic about it is the federal legislation has insurance companies and businesses. The state legislation is just hospitals that would be covered by the transparency, but it is being pushed by business groups, companies that are self-funded, people who usually, wouldn't be they don't want regulation on their own businesses because regulation costs money to business. Yet they're fine with saying, let's regulate the. Thank you, Renee. That's exactly what it is. But
Renee always says what everyone on here wants to say, but can't say.
It's just ironic that the groups pushing for it are the ones that fight regulation every step of the way.
I know. It's so bizarre.
And some of them don't comply with the federal regulations already. It's easy to figure that out. So that just gives you an idea of the stuff.
You guys have to do. Representative Dave Armstrong has a question. What about what amount do you lose on Medicaid services?
I'd have to go back and look at our annual report, but it's significant. I should have that number on the top of my head. I don't want to be online saying what it is, but I'll get that information, Dave. But we do lose significant amounts of dollars because Medicaid pays us as a critical access hospital. We allegedly get costs from Medicaid, but we don't. We lose significant money every year.
Sure.
On Medicaid.
Well, Dirk Miller put in the forecast, so that he's always letting us know when it's time to wrap it up. But I just want to quick say the Dryden family is doing their part to help out local health because my niece Maya Dryden works at Spooner Health, and she said she saw you one morning because I don't know what she worked, like overnights or something. I don't even know what she does. She said she saw you one morning, and you had said, "Oh, I don't really see you around here" or something. She's like, I think she said something about that she had told you that, what are you talking about? In 6 months, I'll be running this place.
I saw the Dryden in her that day. I'll just say that. But, she's a great young lady. We love having her here, and she's in nursing school, and we hope to have her for a long time.
All right.
So back to before you do the forecast.
Sure.
I really got in the weeds, but that's an example of what takes time in healthcare. I mean, that's what I'm paid for, is to deal with stuff like that and try to do it. But it takes time. Anytime there's regulations like that, we're putting people in to do work that does not really benefit patients. I'd rather I look at my business office and the people we got in prior authorization, that great people doing great work, but that's things that could be providing healthcare too, if not for the craziness we deal with.
It sounds like, have you ever heard of, what are they called? SMART goals. You ever heard of those?
Yep.
Specific, measurable, actionable. Yeah. We do this all the time in the business that I ran before, and I thought it was the biggest waste of time. So I spent 3 hours on this and going, 3 hours I could have actually been, doing my job This is silly. And then you have to do a recap of it from the week before. It's just a waste of time.
I don't know. We set goals here because it sets everyone in the right direction. So, yeah.
What, are you guys doing SMART goals? And I was just totally banging on.
We do goals, but we don't use. We don't call them SMART goals, but a lot of the same stuff: measurable, achievable, time constrained. Yeah.
I should do one of those for the show. You should do one of them for the show, and I'll see if I can actually do it for right. Exactly. So Dirk, I think this is too much to put on the screen. I'll try. Yeah, it is. It's just sorry, it won't show up. I mean, it does, but it doesn't. Cloudy highs, upper 20s to around 30. Winds low tonight, 20s. Cloudy tomorrow, highs. I'm just trying to get to the colder temps over the weekend. Highs in the single digits. Oof. Lows will drop below zero, so cold's coming in. The cold air will continue through at least the middle part of the month. Oh boy, buckle up. Winds will be probably starting Friday, lasting through the weekend. Could see gusts up to 30 miles an hour. Well, if we're in single digits, man, we're going to have some way below zero wind temps. I'm watching late weekend winter storm. Right now, it looks like it will us. I don't know if that's what that means. Right now, it looks like it will. We still need some light snow from the system, so it doesn't sound horrible, just really, really, really cold.
Before we end, can I tell you a quick story?
I would love to hear a quick story.
I had a meeting with someone from out of state who came the other day, and she came armed with information about me. She had Googled me ahead of time. She found 21 questions I did on DrydenWire. We went to the same college, she was a few years behind me. She found a couple other things. She found a DrydenWire live that I was on and watched a little bit. So you contributed to me basically being stalked, Ben. So thanks for that.
Yes! That's the whole goal.
It was really interesting, the things she was coming up with. But it also shows you how, boy, if it's online, it's permanent. So.
Yeah, kind of find out. The internet doesn't go away,
Yeah, exactly.
which is good or bad. In your case, hopefully that was good.
Yeah.
I remember your 21 things. They were great.
Conversation piece. So,
yeah. So do you have this Packers or Cowboys? Who do you got winning?
Cowboys by, I saw the spread was 7.5. I think the
really?
Cowboys will cover the spread too.
That's a little higher than I thought.
Yeah, me too. But I think the youth of the Packers will show up.
So you think the Packers are going to win, but they won't beat the spread?
No, Packers are going to lose by 7.5 or more.
Oh, okay.
As hard as it is for me to ever pick the Cowboys.
Why? Why does everybody hate the Cowboys? I've never understood that.
If you
like the Vikings, you're going to hate, or not hate, but we're just saying that because, we know what we mean. Sports hate's different than real hate. So you'll hate the Bears, you'll hate the Packers, but why the Cowboys? How come everybody hates the Cowboys?
Since 1972.
Why?
When they beat the Vikings in the playoffs on the original Hail Mary, Roger Staubach threw it up in the air to Drew Pearson. Drew Pearson blatantly pushed off on our receiver or on our D-back name.
Here we go.
Game-winning touchdown. Plus, that whole America's team stuff, when they were America's team, that just annoyed me. So
I like the Cowboys.
I'm not a Cowboy fan.
Well, I'll pick the Cowboys too.
You like the Bears too, so what does that say?
Not much.
Yeah.
I'm a masochist, I guess. Hey, Mike, thanks so much for coming on. Thanks for talking about some cold flu, COVID stuff, walking us through some things. Thank you.
Thanks for having me. Always a pleasure.
For DrydenWire.com, I'm Ben Dryden, and you've been watching Positive Tuesday with Ben and Fitzy, presented by Professional Exteriors and Interiors. With 20 years of experience, this locally owned and operated business provides quality work both on the inside and on the outside of your home or business. Give them a call today, see what they can do for you. 715-520-2271. Special thank you to Spooner Health CEO Mike Schafer for stepping up and filling in for Fitzy this morning, who will be back on next week's show. So until next week's show, thank you for watching, and as always, have a blessed day.